Jessica, you kind of look sad.
I miss conferences so much, and this virtual health just makes me miss conferences even more. I have been watching virtual health all day long. Nobody has tried to make plans to go drink with me later. Nobody has handed me a little slider to eat. There is nothing going on. There's no one to talk to. There's no bullshit about healthcare to talk about. Like, I can't do it anymore.
Well, we'll have to have a virtual watch party. Invite all of our friends. What else can we do?
Ooh, okay.
Or instead, we could just do
this.
What's
the
this?
October 13th episode of Health in 2.0. So the only thing that could potentially make me happy is more IPOs. So what about this Clover one?
Well, I mean, no, we talked about it very briefly last time, but what we haven't talked about is Kevin O'Leary's article, the guy, not the Shark Tank guy, the other guy's article about it, which is well worth the read. One gets the impression he is not, he's not a fan, does not believe it's all it's going to crack up to be. So that'll be exciting.
That's interesting. So on the WTF Health YouTube channel, I have this theory about companies that are about to get a lot of investment rising up to the top of my playlist. And they are one of them. Over 1,000 views of this video that I did a year ago with Vivek Garipaldi, the CEO from Health 2.0.
Well, so what's funny is he was on a panel at Health 2.0 with me, and he didn't talk about the bit which I thought was the most exciting, which is the bit that they have a medical group that goes into people's homes. But they did talk about their app, which they're now going to try and get doctors to use as a health plan. Kevin was not very impressed by that. Anyway, moving on. Okay. Having said that, there's all kinds of good stuff going on. I wrote a piece about Humana and their value-based care and how that looks a bit odd. That's on the healthcare blog today.
No, that was very good. I read that.
Oh, I'm glad you liked it. I'm sure I misspelled rogue or something else.
You did misspell a lot of things. However, I am not the kind of jerk who calls out your spelling mistakes on a recorded show for everybody to laugh at.
I'm laughing.
Maybe you'll learn a lesson about the high road. Get your timer. Where's my little rooster? Get him ready.
The timer rooster is 2 minutes away, so we better get going.
Okay. I love that timer rooster. It's really the best part of this whole show. It's not going. You can just continue to turn that to me, and that timer has not started. There it goes. Datavant gets $40 million in a Series B. This is an open health data platform play. Tell me about this one.
Yeah, there's a company called Roivant, which is like a drug company that's been spinning off these companies, and Datavant is one of the biggest. I mean, the biggest of their spin-offs, and it's something to do with putting data all in one place for clinical trials. I'm not quite sure the difference between they're a partner of Komodo and Clarify and some of those other data plays. So it's one of these big data plays for drug companies, constantly more than that.
Okay. What about Mira? They get 2.7 million. Their CEO says they are like Costco, but for healthcare.
It's another discount card. You could pick these up at Walgreens. They're totally stupid. Other than, of course, GoodRx was eventually one of those, and they're billionaires now. So who knows?
All right. What about Avail? They get 100 million in a Series B. This is a telehealth platform specifically for the OR. The round was led by D1 Capital. What do you think?
Yeah, odd because, I mean, that's a big number, right? And this is implying two things. One is that surgeons are sufficiently humble. They're going to look for advice from a remote person during an operating room. Not like any surgeons I know. My dad was one.
I think so.
And the second thing is that they, both Teladoc and American Well bought a kind of in-hospital platform. InTouch was one and Avality was the other. And I think InTouch cost 600 million. So if they've got a raise of 100 million, they've got a valuation of close to that now. So I don't know how much more they're going to be worth.
Yeah, we'll see. What about ScriptDrop? They get 15 million. This brings their total up to 27 million. They deliver prescription drugs on demand for pharmacies.
Well, the good news, female CEO from Ohio to the heartland. Bad news, it's just another rush pharmacy like Alto who's got all that SoftBank money. So maybe it's going to be a big deal.
All right, what about Abridge? They get 15 million as well. This helps patients transcribe their doctor's appointments. You tried this, you said.
I've actually tried this. I should when I was a CEO from UPMC. I tried this with him. And,
there he is, the highlight
there's
of
the
the show.
Timer Rooster came. So it's, you take your iPhone and you sit it down, or whatever, in my case, my Android phone, you sit it down and you let it run, and it records the conversation, and then it gives you a transcript. A year ago, well, you know what Reid Hoffman used to say about you should ship product you were embarrassed about first? They were definitely the Reid Hoffman camp. It's been I did it with my primary care doctor, and it was like.
Did you ever listen to it? I would feel
I didn't listen back. I read it back.
Did you read it? Okay.
You're supposed to get text, and they're supposed to take stuff out of the text. It was a long, long way from prime time then, but it is hitting on a big problem, right? The big problem is that patients go to these meetings with their doctors, and they have no idea what the other doctor said, and they somehow get the notes out of it. They're one of the only ones I know who are doing it on the patient side. There's a whole bunch of people trying to do the recording part. Like say Cara and Robin and Suki and and then Nuance on the doctor side. I don't see an obvious place to revenue on the patient side, but they got 15 million this round. They actually going to raise like 5 or 6 million when I've heard about them last time. So they had their own US ventures in there. I like the idea of fixing this. I hope they're going to get it right as of I need to try it again. It's about time I went to a doctor again, probably.
Oh, probably. Maybe you should check your transcript, see what that date was on that. I was going to say though, but what about like medical malpractice? I wonder if there would be like a play there with that, if everything's recorded.
Well, but theoretically, right, everything in the doctor's obviously supposed to be recorded anyway. Isn't that the whole theory about electromedical records?
Yeah, but have you ever heard anybody in a risk management job go on and on about data errors and documentation? That leads to like more lawsuits than anything.
Can I like to point out that I don't talk to people in risk management jobs?
Oh, I do all the time, actually. My favorite collection of them are located in Alabama, by the way. So yeah, you need more risk managers in your life. I'll tell you that much.
I need a bit more risk in my life.
I don't know.
So far, I'm sitting at home doing nothing.
Should be watching Health.
It's much more dangerous than out drinking with you at Health.
Yeah, see, risks managed. Do I miss drinking at Health? Do I miss drinking out anywhere? I miss everybody. To follow the fun that I'm not having, you can find me up on Twitter. I'm at Justamasa. To find this guy up, I don't know, managing his risk, or if you're a risk manager who just wants to reach out, he's at Bolty Boy and would love to chat with you. And you can sign up to receive our cute little email newsletters from thehealthcareblog.com in order to never miss an episode of Health in 2.00, or just simply hit subscribe on our YouTube channel. We've had a lot of takers on that route lately. A whopping couple hundred people subscribed now to that channel. Can't complain. I don't know.
But we still will.
I feel like all I did was complain about how I wish I were at conferences. But seriously, this made me miss it so much. I'm really excited to watch the next couple of days of Health. I think it'll be fun. So far, the big news.
No, you're not.
I do. I mean,
you just want to be there. You don't want to. You don't want to be. You
just want to be
charge
there.
anything, do the whole thing, hi to people, and grab people to chat with them, and go and a few cocktails.
Oh, I miss it so much.
It's a really. I mean, I don't know. There was an optimistic article in the New York Times today saying that we're going to get back to this stuff by mid-2021, and if that's
I hope so.
Then I hope so. Then hopefully we'll
the
be
poor people at whatever conference I go to first. You better all watch out.
We're just going to be moving to Vegas and we'll be overrunning.
I'm going to be talking to everybody, literally the whole time. All right, well, let's wrap this up. We'll see you guys again soon. We've got more deals to cover, so we'll be back this week for sure. Mr. Holtz, a pleasure as always. Everybody else, pleasure. We'll see you soon. Bye.